Hi everyone. Today I will be giving my presentation on the economic impacts of COVID-19 on the mental health of different demographics on a global scale. First, who am I? My name is Emily Yu and I am a rising senior or 12th grader at Oakton High School in Vienna, Virginia. On the right is a picture of me and sadly not my own dog. Both in school and out of school, I partake in many extracurricular activities. The first activity I would like to share is robotics. I'm the captain for Akuba Robotics FTC 369 team. So on the right is a picture of the two teams Oakton has. Next, I'm also on my school's volleyball team. And this picture is a picture from our Dig Pink game back in sophomore year. So in addition to playing, I also coach for my local youth organization. Lastly, I'm also a volunteer at Branch Out, and some of the information I will be sharing today is from the research we worked on last year as a team. For my future career plans, I'm super interested in computer science, medicine, and chemistry. And in the future, I hope to pursue a career with the intersection of my interests. So let's get on to my actual presentation. Today, I will present about how COVID-19, the economy, and mental health come together at a time like now. Especially due to the pandemic, economic burdens and mental health go hand in hand. Many people experience economic burdens such as unemployment and extra medical bills, which extenuate the mental health of all those involved. In addition, with the effects of self-quarantine, lack of exercise, and lack of personal communication between family and friends brought upon by the pandemic, an alarming amount of people have been reporting symptoms of anxiety and/or depression. Especially in a time when there are less people around others, it is hard for people to cope with all the losses that are created by COVID-19, which make it easier to develop signs of depression and anxiety. Without proper treatment and care, these symptoms worsen, which may start affecting their daily lives. Today, I will be presenting on how different demographic groups experience the effects of COVID-19 differently, because some are more affected by the economic hardships brought upon by the virus, which makes them more likely to develop more severe mental health symptoms. So before I get on with my presentation, I would like to define mental health. So mental health is a global health crisis that includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. So in today's presentation, I will be focusing in on anxiety and depression. In addition, some of the economic effects of COVID-19 involve lockdown measures taken to mitigate the impacts of COVID-19, which resulted in reductions in production and consumption. By May of 2020, there was a global consumption loss of $3.8 trillion and 147 million full-time job losses. These numbers are humongous to say the least. So for my research, I looked at how these economic effects of the pandemic impacted the mental health of different demographics, such as gender, age, income level, and race. So the first demographic I will be talking about is gender. In mental health, men typically experience more of an increase in anxiety and depression than women. So according to the CDC, women, however, experience a higher initial rate of anxiety, as the initial rates was 35.4% when compared to 26.1% for men. For the economics aspect regarding gender, the service sector, such as nursing involving women, suffered the most, 47% women compared to 28% men. One more trend to point out is that in general, single women and women with a low education also suffered the most. So this slide shows a statistically significant test for the proportions of symptoms of both anxiety and depression by gender from the week of April 23rd to the week of May 5th, 2020. Next, we looked at the impact on age. In the mental health aspect, the young, which is mostly ages 18 to 30, typically experience more severe mental health impacts, as the Penn University reported that 69% of people from 18 to 24 experience negative mental health impacts. In addition, the young suffer from job loss, and those who did lose their jobs were 64.7% more likely to worry about their mental health. The overall trend in the economic aspect was that young workers were the most likely to suffer from a job loss. Those aged 18 to 29 are 2 times more likely to get laid off or face income cuts than those aged 50 or above. However, the older population also did experience some hardships, most notably medical care and food insecurities. So for income level, 33% of lower income workers reported rates of psychological distress, as opposed to 17% of high income workers. Additionally, adults with an annual income level less than $25,000 reported feelings of depression double that of adults making $100,000 or more. Due to the pandemic, there was a great need for rainy day funds since many families experienced job losses and extra medical bills. However, there was a higher percentage of low-income Americans who did not have a safety net for these rainy day funds, further contributing to their stress and anxiety levels. Lastly, low-income workers were less likely to be given the chance to work at home, which led to a greater risk for them of contracting the virus. With this constant fear of becoming sick, many lower-income workers were more likely to develop severe symptoms of anxiety. So the last demographic we looked at was race. However, this demographic was less straightforward than the others. There was conflicting data that showed a complex correlation between race and mental health. It can be seen that Caucasians used mental health services the most during the pandemic, with 48%. However, Asian Americans were least likely to reach out for help, with only 22%. Overall, racial minorities often held low-paying and high-risk jobs, such as restaurant workers and cruise ship members. So overall, there were a few groups that were impacted most by economic impacts of COVID-19, which in turn impacted their mental health. Those from lower income levels were more likely to lose their jobs, younger adults between the ages of 18 to 30 because they are also more prone to job losses, minority groups, mainly Hispanics and African Americans, and women, because many more worked in service sectors. And during the pandemic, because most of these recreational places were closed off, they experienced more job losses than men. As seen before, these job losses directly led to an increase of depression and anxiety levels in workers. So what can we do to help? First, something that we can all easily do is reach out to our friends, family, and even classmates that we may not even know very well. Next, we need to understand the world around us. Not everyone is as privileged as some of us are, and we need to help others as much as we can. By educating others and ourselves on the importance of mental health, we can be of better help to people when they are in need. Lastly, we need to take care of ourselves and others. We are in the best condition to help others when we are the most healthy and happy with our lives. So here are the few references I used throughout my presentation. Okay, so lastly, I would like to acknowledge some of the people who were able to help me make this presentation happen. First, I would like to thank my Branch Out Summer Research team from last year for working together to understand this global health issue. Next, I would like to thank my friends and family for their endless support and the Global Health Leaders Conference for putting together this wonderful conference. Last but not least, I would like to thank the audience today for listening to my presentation. If you have any questions, please reach out to me. My email and Instagram are at the bottom, and it has been such a pleasure speaking to everyone, and thank you so much for coming out today.